Here. Thank you, Rob, for that kind introduction. And you do look a little bit more confident with a tool in your hand and not when I'm holding it. Thank you also to the SIG and the conference organisers and stream organisers for giving us this chance to talk about the tool and a little bit about the fusion of animal science, veterinary science and engineering that has been together on this journey to develop the Numnuts tool. I'm just trying to work out where all the...
Well, you click on your name.
I click on my name and up comes a slide. As Rob says, here's a tool. Those who haven't been to stand 154 and talk to Robin and Ewan, do so. You can play with it, get your hands on it, apply a ring. We have some model lambs you can apply the ring to. You don't have to apply them to any of your friends. And before I start the presentation proper, the following disclosures related to the presentation. The funding sources for all the work has been from 4C Design, the design and engineering company, Meat and Livestock Australia, Australian Wool Innovation. I personally have no financial interests, and as Don Broom and somebody else said the other day, it's like, to say I have no interest whatsoever is, well, there's a reason why I'm doing this, because I'm kind of interested in animal welfare. But no other financial conflicts of interest, and I should mention that all animal work was done under the approval of animal ethics committees at each of the institutions involved. So the problem, lamb marking. Here in Australia, I estimated a couple of years ago, probably 60 million lambs per annum, more or less, are marked. Might be a bit less this year with the drought, might be a bit more in other years, but yeah, doing some rough back of a beer mat calculations, around about 60 million lambs. That's a lot of animals. By marking, we call it marking because we stick an ear tag or an ear notch in, but most of us, when we talk about marking, we're talking about castration and or tail docking. From recent surveys from AWI and MLA, about 95% of merino producers use rings for castration and 60% use rings for tail docking. A hot knife or a knife is still used, and particularly when you're mulesing, but a lot of people now who are mulesing might mulese, hot knife, tail dock, but stick the ring on the males, on the scrotum. And I think we're past the stage where we're going to argue that marking is painful. What's pain? And it's an unpleasant experience, sensory and emotional, and it's associated with tissue damage, actual or potential. Once we've undergone a painful procedure, anyone here had a root canal or a tooth out? Do we actually feel that sort of vestiges of pain the next time we go to the dentist and think we might have to have a root canal or a tooth out? Yeah, so there's the potential tissue damage. There's a little bit of a fear side of things that gives you that unpleasant sensory and emotional experience that's associated with pain. What we do see is when an animal or when a human being and anybody is in pain, there are changes in our physiology and changes in our behaviour. Whatever it is that is injured doesn't work, loss of function. You twist your ankle, your leg doesn't work, you're lame, you're limping. When it comes to things like lambs, if they can't function properly, they're focused on their pain, they can't find their mum. So we get problems with mismothering. They're stressed, they're distressed. And put all this together, it's a welfare issue. And it affects not just the animals, but it affects our businesses because it impacts on our social licence to operate and it impacts on our market access. If we drill into ring marking, what happens when you apply a ring? There's ischemic constriction. That rubber band, if anyone... I actually asked this at a recent conference. I said, anybody here put a peg on their finger or had a peg on their finger or an elastic band on their finger? And there's absolute silence in the room. Has anybody here got brothers and sisters? Why have you or your brothers and sisters never had a peg on the finger, peg on the nose, peg on the ear, elastic band on the finger? I don't know. But what happens, there's that pressure. First of all, there's the discomfort of the pressure. Now, as that pressure increases, the blood supply is inhibited and you get tissue hypoxia. Now if we take the peg off our nose or off our ear, we get that pins and needles feel as the blood supply is coming back. If we don't take it off, we actually get what they call the ischemic cascade in the tissues. So there's this build-up of metabolic waste products, the tissue goes acidic, that affects the cell membranes start to break down, the mitochondria within the cells become damaged, proteolytic enzymes are released, the tissue autolyzes, it kills itself, it necroses, and ultimately it falls off. And that's kind of the whole point of ring marking, is that you get autolysis and the tail falls off and the scrotum falls off if it's short scrotum, and if it's scrotum and testes if it's full castration. So that's what's happening in the tissue, that's what we know. In terms of pain, when my sister put the peg on my ear, first of all I felt the application. Then gradually this pressure increased to the point where actually it was really, really, really sore, and apart from the fact that she was sitting on me, I was trying to get the peg off my ear. And that's that period of constriction and development of ischemia. Now, if you take the peg off the ear, I go into a phase where the pain reduces, the tissue resolves and the tissue heals. And the same in ring marking. When we leave the ring on, ultimately that tissue will die, the pain will actually reduce, and we'll get resolution and healing. In a pain situation, we can talk about fast pain, slow pain, and I'm sure most of us talking to our clients, our dentist will talk to us about it. Fast pain is that immediate, we can feel it straight away. That's your nerves jangling, your message straight from the point of the insult to your brain. This hurts, take the peg off your ear. Take the ring off your finger, whatever you're doing. Actually, that's an aside from my divorce, but forget about that. That pain, yes. Anyway, that fast pain is felt immediately. That latter can't be blocked using local anaesthesia, but the pain of an insult can be blocked using local anaesthetics. Now, this slow pain that happens after an insult, that ramps up slowly, because of the different physiology, this is the one that we mitigate using the non-steroidals, the meloxicams, the flunixins, the carprofen. We're attacking the COX-2 receptors, we're slowing the prostaglandins system, and we're blocking that inflammatory pain. The question to the scientists is, do we know enough about what's happening in ischemic pain to say that non-steroidals that are selected to work on the COX-2 and the prostaglandin system, do we know how much they're doing to ischemia? I don't. I read lots of articles and I don't. So there's been some articles that have looked at use of non-steroidals on band castration of calves, which is an ischemic constriction, and have found maybe moderate responses rather than significantly good responses. Is it because we're picking the wrong agent? In converse, in lambs, there's quite a few articles that are actually showing quite good block of the ischemic pain of castration in lambs from meloxicam, flunixin, ketoprofen, tepoxylin. So it may be that cattle and lambs are different in how they actually physiologically manipulate and manage their pain and their insult. There's lots of stuff we don't know about ischemia. If we go back to, forget about ischemia and the long-term things, local anaesthetics. We know local anaesthetics work. Anybody here castrated a horse, castrated calf, injected a local anaesthetic? Anybody here prepared to tell me that local anaesthetic doesn't work? No. Local anaesthetics are great. Local anaesthetics, I would not go to the dentist and have a root canal without a local anaesthetic. I'm not going to take an ibuprofen if I'm having a root canal. I'll have my local anaesthetic first, please. The problem is, on a farm with hundreds and hundreds of lambs to do, you're moving so fast, and the skill required to inject the local anaesthetic in exactly the right place every time, without injecting yourself, using a very small volume of injection, making sure you get it at the target for injection, it's quite difficult. There's also the fact that the local anaesthetics are S4s, so as veterinarians we have a responsibility through proper prescribing. Do we go out there and stand there and inject lambs? Can our clients afford it? do we want to stand there all day and inject lambs? And then there's the environmental safety side of things. What do you do with all the needles and syringes when you're finished? So a lot of challenge to actually providing local anaesthesia on farm. So the numnuts, on to numnuts. The point of developing numnuts was to try and address some of these challenges, make it easier to get that local anaesthetic into the target tissues repeatably, and make it something that farmers could implement on their farm, on their day-to-day life. So the animal research outcomes that I'm going to talk about and the results I'm going to show you, most of these are pilot studies. Most of the work we did were little pilot studies. They were to inform the design process. I'm not assessing the ability of lignocaine to alleviate pain associated with lamb marking, with castration and tail docking. You've all told me that you believe lignocaine works. I'm quite comfortable that lignocaine works. Maloney et al., Mellor et al. In the 1990s published plenty of papers showing that local anaesthetics work. I think my ethics committee would be very upset if I said I needed a trial to show that lignocaine works. Because they'll say, well, we know it works. We had a horse castrated the other day and the vet used lignocaine and it didn't kick his head in, so it's got to work. So our key question for the research was not, does lignocaine work? The key question was, with the numnuts tool that we're designing, with the prototypes, are we providing an improvement in welfare over rings alone? And I've paraphrased Donald Broom here, and I haven't given a specific date for when he originally said welfare is the state of the animal in terms of behavioural, physiological, psychological and pathological attempts to cope with its environment. He said it numerous occasions, most recently this morning, yesterday, the day before. I think we all agree on that one as well. So, then we choose the methodologies. Now, if I was going to be assessing whether lignocaine works or not, or say somebody came to me with a brand new agent that might be a potential local anaesthetic, I might say, okay, let's address some of the physiological stuff as well. But because we know lignocaine works, and all I'm looking to see is there a welfare benefit by giving lignocaine using the numnuts prototype, I'm using behaviour. And for all the trials we did, regardless what they were, it was a standardised ethogram. We picked these key behaviours, restlessness, the kicking, foot stamping, the rolling, these classic pain-related postures and behaviours that you see with ring castration and ring tail marking. We picked those, so every trial we did used these behaviours as their marker. We might have slightly changed how often we assessed or how many lambs we assessed, but the actual methodology was all on behaviours. We did a lot of live observations. We did an awful lot of round a few sheep up, try a prototype and sit there with a clipboard counting how many kicks, how many foot stamps, how many rolls, how many jumps we saw in a period of time. Once we got into more detailed assessments, we would use video footage, put the lambs in a pen, with or without their mother, take a video, and then offline, an observer that's completely blinded to whatever treatment they've got can sit there and exactly the same count how often the lamb got up and down, kicked, foot stamped, jumped, rolled, licked, wiggled its tail. And those who were at the talk, Serena's talk yesterday about measures for animal welfare and assessment of pain will realise that there might be one or two behaviours here which are really characteristic, but to really get an answer, we add them all together and come up with an average or a proxy for total pain behaviours in a period of time. Some of the pilot stuff we answered with a little, we even called them stuff-abouts. You know, they were so pilot that I wouldn't write them up because it's not balanced trials. You know, can a single central injection of local anaesthetic improve welfare? And we did. We rounded up some lambs, and some got a standard illustrator ring, and some of them got a central injection of local anaesthetic, and yeah, we did get an improvement. It was a small number of lambs. It maybe wasn't a great improvement, it was an improvement. That was 2013. Then it's like, well, okay, how much local anaesthetic do we need to use to get an improvement? And again, a pilot scale study with only 9 lambs in each group suggested that 1.5 mils of lignocaine is sufficient. What's interesting, and I'm not sure about the pointer for this one,
is that 20% or 2%, Alison?
It's 2%, 20 mg per mil. I knew I can't type. I know I can't type. 2%. What we found, what's really characteristic on this diagram is characteristic of all these behavioural measures we use, a huge individual variation. You know, there are lambs that have a complete tanty and roll around, regardless what you do with them. You might even just have sham handled them, they're having a tanty. And there are lambs that you can do an illustration on and they'll just stand there going. And that's the same with human beings. Those of us who have kids, have friends with kids, have got grandkids, have seen exactly that. There is a variation. That's a challenge when we're assessing and using animal behaviours to assess pain. So what we found, there was a weak negative correlation between the amount of local anaesthetic we put in and the actual pain score. So once we got up to 3 mil, there was less pain than if we were using 0.75 mil. Once we got up to 3 mil, on the tails, if we accidentally popped through the intravertebral ligament, we had a paralysed lamb. His legs didn't work, and if we want to be reducing mismothering, having a lamb that can't walk is not really good. So 1.5 mil seemed to be doing the job. It was sufficient. We also wanted to know, well, how deep should that needle go in? Now we found when the needle advanced 6 millimetres, we could probably get it into the tails fairly consistently. But on scrotums, we definitely got injection failures at 6 millimetres. None at 8 millimetres of 10 mils. I think our advance is currently 12 mil, Robin? Yes. Yeah, and if anyone's been down to the stand and seen the video, there's a video of an injection which is green. And that was our methodology for assessing how far the needle should go in. If we saw green running down the back of the lamb or between its legs, we knew we had missed the target. 2015, we were at version 7 of the prototype. The engineering team had done a wonderful job with the ergonomics. The tool is now a secateurs type arrangement, so your arm stays straight throughout whatever you're doing. It's comfortable. You pick up an old-fashioned illustrator tool. Yes, you can open the tool in that position, but to actually get it on a lamb in a cradle, you have to do that or that. So in terms of long-term ergonomics, this is likely to reduce the RSI long-term on farms. The team are still working on the exact geometry of the injection for castration, but they're definitely getting consistent delivery into tails. So this was the time to do a tail docking study. So we have a pen study here. We have video behaviours, video footage of these ewes and lambs in their pen. This study's done in the Moradin Institute in Scotland, so this is Scottish grey-faced cross ewes and lambs. Just tails, just ewe lambs, just tails. The videos where the Numnuts team and the Moradin team got together, did the deed, put the lambs in their pen. Videos were taken, the lambs are all numbered or coloured, and the videos on a hard drive arrived in CSIRO about 6 weeks later. And our team of trained behavioural observers did the observations. So we counted how many times the lambs performed a behaviour on our list of pain behaviours in a minute, at 5 minutes, 10 minutes, 15 minutes, 20 minutes. And where I've got the letters, it's a significant difference from the baseline. So in this picture, the green lines, they've been handled only. They've been picked up, they've been put in the cradle. They might have a wee manipulate of the tail and the scrotum as though you were going to apply a ring, but then they've been taken out of the cradle and plonked on the ground. No ear tagging, nothing. So the green ones, at 5 or 10 minutes, the observer did record some pain behaviours. But remember, these pain behaviours include things like tail wiggle, a kick, a foot stamp. If there's a fly, a lamb might kick. Or having been very recently released from the cradle, the lamb might still be trying to find its mum, so there might be a boing, there might be a stretch, something happens. Very often we do actually measure what you would call a pain-related behaviour in a sham handled lamb. Red line is ring only, illustrator ring on the tail, and you can see at 5 minutes there wasn't a significant difference, and that's to do with the individual variation, the standard deviation around the average. This is the average of all the lambs. I'm trying to remember how many lambs were in the trial. 15 in a group, 12 or 15 at this point, I think. At 10 minutes, we're significantly different from the sham and from the Numnuts lambs. 15 minutes, definitely they're displaying their pain-related behaviours. And then it tails off as you get to 40 minutes. And gratifyingly for the Numnuts team, the blue line, which is the Numnuts treated lambs, were very, very similar, not significantly different to the sham handled ones. Yes, they have a welfare benefit. We were happy. Progress, continuing. Right, remember I said that the geometry for castration injection was not fixed at this point. A year later, 2016, we've got the injection geometries finalised, and this is version 12. Now, for version 12, we were now at the stage where it's close to product launch. What do we need to know in terms of welfare? Do we need an efficacy study for lignocaine, or is our question still, do we get a welfare benefit? Before I go on to talk about the study, I should talk about what's important on the tool and the injection geometry. I'm a trained vet. I can inject, but if you give me a syringe and a needle with 1.5 mils of lignocaine in it and ask me to inject into a scrotum, the chances of me actually hitting the two spermatic cords is kind of minimum. Even if I applied the ring, I'm liable to inject too low. So that first picture here, the local anaesthetic, the injection is marked as that orange splodge. If I put it there, we all know how lipophilic lignocaine is, local anaesthetics are. It's sucked into the cod fat. It's not attacking the target tissues, which is the nerves and the spermatic cords, which are white with the testes hang. I don't know why am I giving you an anatomy lesson for vets. If I'm lucky, I'll get it in between the two, and then I've got a chance there might be some diffusion into the nerves. If I'm really unlucky, lignocaine's liquid, we're injecting into a potential space, everything might just disappear down and be in the top of the scrotum. We might have a nice numb piece of scrotal skin, but not the spermatic cords. So what Robin's team has done, which is really clever, is uses the ring. So here's the Numnuts tool. Expand the ring. I don't know how often this has been expanded, so I'm expecting it to take off. Expand the ring, you put the tissue, I'm not putting my finger in there, you put the tissue in, but as you close the tool, the ring squeezes the tissue right up against where the needle's coming out. So then when you actually plunge, the plunger, the needle advances into the tissue right where it's needed, and then the injection's given. So that was the important thing about the difference between version 7 and version 12, was actually they'd got that geometry right, so the injection is right where the ring is, and the ring is bringing the two spermatic cords together. Essentially the same for the tail. If I inject into a tail before I put a ring on, by the time I put a ring on, the local anaesthetic could be anywhere. Well, same with the version 12 tool and onwards, the injection is right where the ring is going to put pressure on. So, do we get a welfare benefit? We did a field study for this, and we looked at the package. Because in most farm situations, we're going to have a mixed mob of males and females. The males are going to get tail docked and castrated, the females are going to get tail docked only. So we bung them all in a paddock together, in a number of cohorts, because there's a limit to how many lambs we can watch in a period of time. So the males were getting castration and tail docking. In the background of the photograph, you can see 3 torsos. Those are 3 observers, and they have got, in order, they take whichever lamb we drop on the floor from the cradle, and they're in charge of that lamb. Every 15 minutes, for a whole minute, they will count how many times the lamb performs these particular behaviours. They each had 10 lambs to look at, and that gives you a minute to score your lamb, 30 seconds to find your next lamb, a minute to score that lamb, 30 seconds to find your next lamb. Okay, if you had a bit of time and a good pair of binoculars, you could probably work out which ones had the rings and which ones didn't, so you could probably work out which ones were the shams. But in terms of if you've got a ring on, how do you know which one had the Numnuts or not? You don't know. So they are blinded to the treatments. All they have got is me shouting, lamb number 15 hitting the ground now. So whoever's next in line takes lamb number 15. The lambs are pre-marked in numbers, so they're not coming out 1, 2, 3, 4, 5. They might be coming 15, 16, 20, 1, so on and so forth. So everything is randomised. And you see in the little picture here, here's one poor lamb having a good old roll around. That's a classic pain response to castration. And the lamb number 3 walking past, you're walking a wee bit funny, so something's happened to him as well. But what we're finding is, again, red is ring only, blue is the sham, the handled only. The handled ones are fine, nothing's happened. The red ones, we've got a significant difference from sham all the way through at these 4 time points, 5 minutes, 20 minutes, 35 minutes and 50 minutes. And this is the mean for all lambs. In the Numnuts lambs, we've got a significant difference from sham all the way through, which fair enough, they have actually had castration and tail docking done. But the Numnuts lambs are significantly less behaviours than the illustrator lambs at 5 minutes and 20 minutes. And that's the time when the peak response is happening. It's important to know, lambs being prey species, it's important to lambs to return to normal, or as near normal as possible, as soon as possible. Otherwise the wolf's going to get you, the fox is going to get you, predators are going to get you, your mother, particularly if you're merinos, your mother is going to take off and you're not going to be able to find your mum, you're not going to survive. So even the lambs that have had no local anaesthetic, their pain response is coming down rapidly in that first hour. But when the pain response is at the peak, the local anaesthetic is helping. Ewe lambs, very, very similar picture. The lambs that are illustrated without pain relief, without local anaesthetic, we've got an increase in pain-related behaviours, and this is coming rapidly back to normal within an hour. But again, the lambs that received the local anaesthetic are significantly less pain-related behaviours than the lambs that didn't receive local anaesthetic. Yes, it's not perfect. Again, those of you who've had a root canal, did it obliterate all pain and discomfort, the local anaesthetic? If you're lucky, it might have done, but most of us, I think, will say there was a certain amount of pain and discomfort still associated with the root canal, but you could cope, you could deal with it. And that's what we're looking at in terms of pain relief for farm animals at the moment. Is can we make an incremental benefit so that the lambs can cope? So, conclusions from these design-related studies, animal studies. We seem to have a rapid and accurate means to deliver local anaesthetic for lamb marking. If you talk to Robin and Ewan, they've been out on big farms doing beta testing on the farms, and the contractors, the farmers, they very quickly pick up. It looks a bit clunky, but when you mark hundreds and hundreds of lambs, within 5 or 10 lambs, you're back to talking about what your kids did at school, what the footy team did on Saturday. The marking contractors and the people who mark lambs every year, hundreds and hundreds of lambs, take to this like a duck to water. It's quite amazing. The local anaesthetic is active at the time of peak acute pain. We can be rude about local anaesthetics. There's different local anaesthetics. Some seem to have a longer effect than others, and that's why trisulfan uses a combination of lignocaine and bupivacaine, because bupivacaine has a prolonged action. But at least lignocaine, which is available, registered for use in sheep, is active at the time of peak acute pain. So it's feasible. We can provide analgesia, and my personal opinion as a veterinarian is that if you're not doing anything for analgesia, you should be. But longer term, as veterinarians, we should be considering multimodal analgesia. As I said before, with ischemic pain, what that agent is, I don't know. We've been at this for 6 years. It's been the most amazing collaborative project because it's brought together engineering, design, ergonomics, animal science, a massive team of people. This is a photograph from the 2013 animal trials. We have got MLA staff, CSIRO staff, 4C design staff, Moradin staff there, Australian Wool Innovation staff there. People have come and gone in this journey, and thank you to all of them. They've been amazing.
Thank you, Alison. Not being one to ask the first question, I'll take that privilege now.